Hi, my name is Angie Chamberlain, and this is my Teach One presentation for HAP823 Comparative Effectiveness at George Mason University with Dr. Alemi. Today we're going to be calculating similar strata using SQL and the Tversky index. And so our problem to solve today is using SQL, we need to predict the response to citalopram for a patient with PTSD and neurological disorders based on the nearest strata in our data. We're going to use SQL to form a solution to stratify the data and determine which strata is most resembling our sample patient. We're going to determine the response to the target drug based on that strata's average response. So step one in any data set is that we want to examine the data and make sure that it is clean and able to be uploaded. And so we're going to take a peek at it, we're going to upload it to our SQL server, and we're going to make sure that it functions properly and that we don't hit any snags before we start working with it. We want to make sure that there's no stray characters, there's nothing impeding SQL from properly reading it, and we're going to make sure that it's properly transcribed to our database. Next, we're going to organize the data. In order to work with this data set, we need to make sure that we organize it in such a way that lends itself to the needs of our problem. So here, in order to form these strata, we're going to binarize the data. And so here we see part of a script. It's a very long script because there's a lot of diagnoses represented in this data. There's about 30 of them, as well as some drug interactions or prescriptions. And so for each variable, we're going to form a binary response. And here's what you see here. So once we've done that, we can create our strata to represent the types of patients we have in our data. So we're going to condense the thousands of patients in the data to a set of different combinations of medical history elements. And so each patient can be represented by one strata, but one strata may represent several patients in the data. This turns our data from individuals into types that we can more easily compare. Next, we're going to summarize the records. So we want to summarize the individual records so that we can grab the maximum value for each variable if a patient has multiple records. Now, keep in mind that we have these records in binary form. And so that means that if a patient in the data has, say, 10 entries showing different diagnoses throughout our data, this script will return whatever the patient has had for the diagnoses in the data. So we're ensuring that all past diagnoses in our data are represented. So if one record shows a 1 for amphetamine, but the next record shows a 0, we're going to default to that 1 and make sure that it combines across all of the entries per patient. Next, we're going to do the same for each strata, so we can make sure that the strata and the patients represent all past diagnoses in the data, and we don't get any confounding variables from multiple records. So we don't want a strata that is saying that it's trying to represent a patient without liver disease when someone in that data may have had liver disease, or they have it in their past. So we want to make sure that the maximum values are returned so that we can have accurate representations of what is being represented by this data in each strata. So now that we have our strata, we're going to create that sample patient that we really want to find out about. And so we're going to use this script to create a new table with all the same variables, and we're going to create our sample patient showing that he has neurological disorders, PTSD, and has taken our target drug. And we want to see how similar patients have reacted to citalopram. Now, the problem didn't specify that the patient has no other past diagnoses. So we're going to make that assumption here so we can actually fill in the values for these variables. But I would have liked to see some sort of note to, whether those other diagnoses were specifically non-existent or we just aren't considering them, which may change a lot for our patient. And that's, I think, something to consider. So we're going to take a look at our matches, and we're going to calculate the matches in the strata to our sample patient in 3 categories. So we're going to calculate matches, which is if the strata diagnosis matches the outcome or the representation for the diagnosis in our sample patient. So if he has PTSD and a strata has PTSD, that is a match. If our strata has a risk of suicide and our patient does not have a risk of suicide, that is not a match. And we're going to add up those matches to score them. And next, we're also going to calculate the partial matches and excessive matches. And so the partial matches take a look at if the values for each diagnosis is not quite the same. Um, we're going to highlight it with the value of the patient score. Whereas for excessive matches, we're going to highlight it with the strata score for that non-match. And that is giving us a little bit more information to compare the information in each strata and each diagnosis. So we're going to calculate similarity scores. And here we calculate the Swirsky similarity scores, which uses asymmetric similarity features to compare a variant to a prototypical profile, which is our sample patient and our strata. And here we have the calculation for partial similarity and excessive similarity, so we can compare the two. And we're going to put that in a table and order it by partial similarity, descending. So finally, our results show the two comparatives for Tversky scores for each strata, and we can use these to inform our comparison to the patient. Here we have it ordered by highest partial similarity, and we see the strata that is associated with those scores. And we can also see the probability of the efficacy of our target drug for each strata. So we can predict that our patient has somewhere around a 48% chance of responding to the drug. But with all this information, we can actually make other informed choices. What if our patient is at risk of other conditions? We can compare the probability of other strata and see if it has a long-term benefit to our patient, or if that benefit of the drug might go away if he develops other diagnoses along the way. And we can also consider these responses or response probability if there are any side effects to the drug, and use that information to determine if it's worth it. We can also use the partial similarity and excessive similarity scores in nuanced ways to really determine how similar or in what ways these strata are similar to our patient, which might come in handy in more complex analyses. End of note, this presentation was made in 2020. In a year where the pressing realities of the pandemic and other drivers of uncertainty, unrest, and challenges, we might become more aware of the unexpected uses of our practices in academia. So while 2020 may have unrailed many plans, we can imagine that it has also inspired us with the ever-growing application of risk skills and studies in ways that we previously perhaps had not considered. Thank you very much.